study was looking at order sets used in hospitals, and I'm from McMaster, so it was done in Hamilton. We know that elderly patients are more at risk for adverse drug events, and these drugs, these potentially inappropriate prescriptions, or PIPs, have been associated with falls, fractures, mortality, delirium, increased hospital stays, so they're very high-risk medications. And we also know that order sets are a tool that are used in hospital frequently. They streamline tasks, and that a lot of these medications can show up on order sets. I think that order sets introduce risk by removing a cognitive step, because the prescriber doesn't have to actually think hard about the medication they're prescribing, they just have to tick off a box. And so we know also from review of the literature that order sets have actually shown to increase the rate of prescribing of high-risk medications like sedative drugs. So what we're interested in finding in this study is to what degree are these PIPs, these high-risk drugs, available on order sets in Hamilton. And so what we found was that using the Beers criteria and the stop-start guidelines, which are well-validated tools, we found that more often than not, order sets in Hamilton actually have one or more PIP on them. Morphine, Dilaudid, Gravol, so these medications are widely available. So 57% was how many order sets actually had one or more PIP on them. And what I thought was even more interesting was the PIPs that were most commonly found on the order sets were NSAIDs, steroids, benzodiazepines, and opiates. So I think these findings are really important because A, we know these medications are high risk. B, we know that order sets increase the rate of prescribing of these high-risk medications. And C, I think these findings really underpin the movement towards making hospitals and institutions more safe for our elderly patients and our seniors. So based on this, we've actually been in touch with the hospital administration and are making some changes already to have the order sets a little bit safer and addressing these.
Have you heard of patientordersets.com?
I've heard of it. We don't use them in Hamilton, but yeah, I think that it's actually a very, based on the feedback that I've been getting, it's a very common problem. You can imagine the hurried, underslept orthopedic surgery resident at 3 a.m. is not really thinking hard about the patient in front of them, and if Gravol 50 milligrams IV is there, they'll just take it off. And we've all been there and used these order sets. So I would argue that not every patient that has nausea even needs medication, and if they do, they probably don't need 50 milligrams of IV Gravol. There's safer medications and lower dose options. So even just what we've started, especially working with surgeons, is having options underneath that say, if your patient is over 65 or frail, consider ondansetron or a lower dose, and things like that. And then in other cases, scrapping them completely. So we're
treating constipation.
Yeah. So there's a lot of really good discussion that's out of this.
Good. Very cool. Thank you.